Hello and welcome to Purple TV Bharat. I am your host Nikita Volvaikar. On the occasion of World Disability Day, we are having a special interview on the topic cerebral palsies. So to know more about this, we have with us Dr. Megha Deshpande. She has done her Masters in Physiotherapy. She has 12 years of experience in pediatric physiotherapy. She is currently working as Senior Physiotherapist and is in charge of Rehabilitation Unit at Novi Survat Center, Sangolda. Dr. Megha Deshpande is a dedicated pediatric physiotherapist skilled in conducting assessment and tailoring the treatment plans and implementing therapeutic executive. Welcome to our show, ma'am.
Thank you.
So we also have with us Braven Barreto, who has done his Masters in Physiotherapy. He is a dedicated pediatric physiotherapist with expertise in supporting children with neurodegenerative, genetic disorders and cerebral palsy, providing personalized care and support to enhance their quality of life through Novi Survat, Goa. Welcome to our show, sir.
Thank you.
So to begin with, ma'am, could you tell us what is cerebral palsy?
Yes. So now cerebral palsy, it is a non-progressive disorder of the brain where it's a permanent damage to the developing brain. So this damage could be occur like before the birth, during the birth and after the birth. So when we say before the birth, so when the child is within the mother's womb, if the mother has any sort of infections, fever, thyroid problems, or any kind of the rubella or any kind of infections. So if the mother is having any infection, so that may lead to the child and maybe have a CP child. Secondly, during the birth, if there is a increase or decrease in the blood pressure of a mother, or during the breech presentation. When we say breech presentation, during the delivery, the lower limbs will come first. So that is also. And thirdly, the vacuum or the forceps delivery, what we say, that is also which may lead to the cerebral palsy child. Thirdly, it is postnatal. When we say after the birth, even when the child has got any sort of head injury or any sort of infections, seizures, or there is a hyperbilirubinemia, so that means an increased level of jaundice. So if any kind of this which may lead to the cerebral palsy. So you have to always see for the early signs for it. So if you consider before the 3 months of the developing, the milestones, if the child is not giving you the eye contact, if the child's the movements you are feeling it very tighter or it's a very low tone, okay, or else if the child is not holding the head. So that times it is between the 3 to 4 months when the child is not doing it. So you have to particularly go to a doctor or a pediatric neurologist or the pediatrician. So then they will check the baby, and so this is all we say the early signs. Then it is come to within the 4 to 6 months if the child is not sitting, and then a year the child is not walking, standing or doing the activity. So in between this, if the child is having any abnormal postures which is not giving it for the child to do a particular movement. So in the cerebral palsy, it will affect the balance, the movement and the posture of a child. So since cerebral palsy is very vast, so in brief I would like to say about this.
Okay, sir, could you tell us what are the different types of cerebral palsy?
Okay, yeah. So how ma'am has previously explained that cerebral palsy is an umbrella term sort of for many of the disabilities that happen, like some inconvenience that happens. Cerebral palsy mainly can be classified into two main categories. From those, one of the categories is your motor category. Now in motor category, what happens is when cerebral palsy happens, what happens is a certain part of the brain or multiple parts of the brain get affected. From there, whenever any motor part of the brain that is supposed to happen is affected, your motor system gets affected. So in this motor system, what happens is when we talk about motor, there are certain types of movements that are affected. So if we start with motor, what happens is first we have our spastic cerebral palsy that mainly focuses on your tightness of the movements. So when you have spastic cerebral palsy, you'll see tightness of the movements, there's certain contractures, the child won't be able to move very freely. There is something called as ataxic cerebral palsy. Now in ataxic cerebral palsy, what happens is you won't be able to do precise coordination movements. There will be lack of coordination. Next we can come to dyskinetic CP. So dyskinesia, what concentrates on is there is lack of precise movements that happens. There is certain moments of jerkiness, there is no steady movements that happen, and then there's a final one that says mixed cerebral palsy. That is a combination of all of these. So you'll have tight movements as well as there'll be difficulty in coordination. So that is the motor part of it. Next we can come to is the parts of the body that is affected. So mainly when cerebral palsy happens, it occurs on your parts of the body, that is your upper limbs and your lower limbs, your arms and your legs. So if it affects both your lower limbs and your upper limbs, it is called paraplegia, so paraplegic CP. If it affects only your right hand side or your left hand side, it is called hemiplegic, so hemiplegic CP. And if it affects only your lower limbs, it is called as diplegic CP.
Oh, okay. Thank you for telling us so much about it. So what are the most common challenges do people with cerebral palsy face?
So now the challenges are, there are list of challenges what these children they face it with. So in that first will be the movement is affected, because as we say cerebral palsy in the spastic, as he mentioned, the spastic cerebral palsy, where we have a tightness of the limbs, so there will be difficulty in moving. So there will be difficulty in sitting, difficulty in standing and the walking. So here first is the movement is affected. Second is the pain. So when these children, they have a much more of the stiffness or the tightness of the muscles, we normally to stretch the muscles. So that time the children will have a pain. And there will be the stiffness of the joints of the certain, the hip, knee, ankle, shoulder joint, anyway. So the pain is the factor, what is the normally they face. The third is the feeding and the swallowing problems. So these children, they have a lack of oromotor control. So there will be not proper oromotor, the muscles of the oral, so they are not properly, so there will be a lack of oromotor control. So the intake will be reduced. Because of that, the children will be having a malnutrition, there will be low birth weight, so these are the kind of problems they face. Then is the communication problem. So some children, they do have there will be a difficulty in language, communication. Then they have a vision problems. Some children of cerebral palsies, they do have a squints. Okay, and then do have a strabismus, nystagmus, so there will be rotating eye movements. So this will affect them for the vision. So there will be not a clear vision for the some children with cerebral palsy. Then they have a mental health, which is a major one what they face, because this the persons with cerebral palsy, they are in a high degree of anxiety, depression, so they do go with the mental health problems. The third is, the next is the bone health, because there will be low bone density, so then they do have a bone fractures, which will be very repeatedly or very soon it may happen. So like that they have like many problems faced. This is what, yeah.
Yes, so would you like to add to it?
Some of the, how ma'am has made it very specific, there are these certain areas that get affected. These also get carried out to your adulthood. So spasticity, tightness that ma'am has reiterated, what happens is when you go into the future, when you grow up and then you have to say traveling, you take the most common challenge is like traveling for a person of CP to go from place A to place B. There's steps, the stairs become a hurdle. Your common commute of a bus becomes a hurdle. So these challenges I feel are minute for us, but for people with cerebral palsy it becomes a huge impact. So traveling or getting access to say a store that sells coffee, and suppose the adult wants to get a coffee, it's this stairs, there's a higher counter, there is, if a person with low IQ cannot read, what's the other alternative that you can get? What if a person has slurred speech, what's another alternative that the person can convey? So those kind of challenges maybe.
Okay, so is there any treatment for it?
Yes, treatment in the sense, see, first of all, cerebral palsy, it is a non-curable one. Okay. But through the multidisciplinary approach, we can give them a better quality of life. So this will be done by the following ways. It's like, firstly, we have a medical treatment. Like there are some medicines what we give the like the doctors they prescribe, that is to control their spasticity, that which will make them to move very freely and easily. The next is, we have many multidisciplinary approaches, as I said. That is like, in that the first will be the physiotherapy. In the physiotherapy, we deal with the balance, posture, reduce the tightness of the muscle, and here we are looking for the strength of a child. We are not looking for the weakness of a child, right? So in which movement the child is able to do. Okay, so and then overall we strengthen the muscles of the child, so that will give a good kind of like the coordination, the good control. So this is what the physiotherapy we do. Secondly, we have occupational therapy. So they do with because all the CP children, there are some children, they do have a sensory issues. So we need to sort it out that also, and for the activities of daily living, that also we need to. So here the occupational therapist, then we have a recreational therapy. So here whichever the child is into, like if whichever part, I mean the child is having a certain interest in doing it, so the recreational therapy, that will give you the much more support. Okay. And then we have a speech therapy, because there are many of the patient, like with the cerebral palsy, they have a speech issues. So difficulty in like talking, or some children they can only pointing out but they cannot tell. So for them, like the speech therapy will be better. Then we have a aqua therapy. So aqua therapy is nothing but we treat our children in the pool setup. So with the help of buoyancy, so which will help them, because we literally do for the therapy for the children. So we have noticed that on the land, if there is a difficulty in performing the movement, but it will be very easier for the children to perform in the pool. Yeah, so this is the aqua therapy. Then we have a play therapy, music therapy, so like, and lastly there will be some surgeries what we like, because there will be the orthopedic surgeries. That is because if there are in the severe cases of the cerebral palsy, where in the spastic quadriplegia or diplegia, sometimes the muscles are very tight. So only with the stretching exercises, strengthening exercises, we will not get much out of it. So that time we have to go for the like the orthopedic surgeon. So then they will do some sort of release, the tendon release, the rhizotomy. So it's like all kind of surgeries when they do it. So even that is also a treatment. So after the surgery also they have to continue physiotherapy. So that time, because when you do the surgery, the muscles will be weakened. So those muscles we have to strengthen them in such a way that we can give them a better quality of movement.
Okay. So how has the treatment been evolved, like over the past years for the treatment?
Okay, what happened, just to add to ma'am's point, is initially what used to happen is cerebral palsy used to be a vague term. So no one used to like directly address cerebral palsy. They used to say, okay, they are disabled, okay, they are this. So now the term cerebral palsy has moved from a point of motor disability to a social disability. So they try to take a whole concern through it. So they just do not isolate the child, they take the whole into it. So a very good program that is initiated is the early intervention center. So what happens here is, which has recently been introduced, what happens is the detection and treatment of all these therapies that ma'am has told start earlier in the years, and as soon as a couple of months after the child's birth. So this wasn't there before. It is over the years of failures and repetitions and successes that the children have achieved, that they've seen progressive, that if you treat them as early as possible, there have been chances that the child has been able to walk or talk or have play therapy, have a grow up into becoming a fully not fully but partially functional person that like has day-to-day activities possible for him. So that is how it has evolved. It was very narrow-minded first. Now I think it has broadened up into a such that we try to include music therapy, play therapy, which would have been just play or music before. Now we add therapy to it because it starts the therapy process from like early in the age.
It is, because I just want to add, yeah, as he said, because the early intervention, so initially what used to happen, literally the patients, they used to come to us after 1.5 year, when the child is 2 year about, and then saying that the child is not sitting, the child is not holding the head. That is almost like when the child is not holding the head, that is means normally the child will hold the head by 3 to 4 months, but still the parents, they wait, or they wait because somebody said no. Sometimes some children they do it like later, like that. So then they don't go to the doctor, they don't go to the therapist. So then they come after a year, after a 1.5 year, saying that my child is still not holding the head. So still the child is lagging behind. So that's how now the early intervention centers, it will be very good, because when you see the early signs, then only you can do it a quick review and then do the treatment faster.
Wow, it was really informative. It helped me also to learn a lot, because usually we just take it casually. Okay, he's not sitting, maybe after some time he will sit and all. So after knowing this, yes, so we need to take care about it. So how can society be very supportive and inclusive for people with cerebral palsy?
Okay, so I think over the years, society has evolved to a point where they do acknowledge that cerebral palsy does exist, and these are the certain things that there have been like lacking of. You see multiple places where ramps have been introduced. There have been people talking more socially about this, and even on social media there have been like many people who have started hashtags and new pages to introduce it. I think that's a very good way to reach out to the whole media setup. But to specifically come to a point is, I think education plays a main role in this. Not just to be very sticking to the academic side of education, but also to raise awareness about the challenges that a person with cerebral palsy goes through, or what is cerebral palsy, just so the people would know. I think gatherings or events that would be better, if they are oriented towards people with cerebral palsy. Also to celebrate cerebral palsy, not as a disability, but as an ability that has been differently abled. So something like that to inculcate everyone, to make I think inclusivity, to try to include everyone and around them, to like celebrate their little achievements, whatever they are achieving.
Okay, that is really well said.
Yeah.
So what role do education and employment opportunity play?
Okay, yeah. So in this also, I feel like the more educated we are towards the topic of cerebral palsy and the employment, I think the better it goes further away, even for the employer themselves. So if your employer doesn't know what cerebral palsy is, there wouldn't be any modifications that would happen at the workplace for your employee who has a cerebral palsy. I think it starts from an overall orientation for the general public as to what are the difficulties that go through, and then how we as people who do not have cerebral palsy can accommodate them into our lives. Also educating, like growing up, educating to try to get these children with cerebral palsy to a point where they are fine with the education that they get. So we do not hold them back. We do not say that, okay, so they can just do ABCD and leave them, which is basically they're like, okay, ABCD is there, so they are educated, or they do a couple of numbers, a couple of maths. No, we push them to see how much they can achieve. So we do not set a bar, I feel, not to set a bar for themselves. Like they can decide, we give them an opportunity for them to decide as how much education they need, so that sets up a standard for the employer to keep a community open, so that okay, yes, you can join us, you can be a part of our team. I think that helps also.
And one more thing what I want to add is, like initially it starts from the school. So here we should not have a bifurcation, like the child, because we should include all these children in the normal school, but make sure that the child is given the special but special attention. But sometimes what happens is, because still now we are struggling because even not all the cerebral palsy children, they have a low IQ, because we do have some children with cerebral palsy, they have a very good IQ. So for them, at least like you consider in the normal school, so then they will not feel like they are left out. Right. And yes, and secondly, like when it comes to employment, when you asked, now like okay, for like some persons with cerebral palsy, like we have to do certain kind of modification in such a way that, suppose if they are working, so it has to be accessible, because if you are giving them with the high floor or the first floor, top floor, it is not convenient for them. So you have to think in such a way that you have to go in a ground floor. It should be wheelchair accessible. So where the person can go, okay, and do his work. Suppose if he is not well or he cannot do it, but he is very good in his IQ. So even you can give the thing with the from the work from home. That is what we sometimes all they do. But then you can give, these are all the small things, but at least it will be like much for these persons with cerebral palsy. So even they will show. So here basically the awareness which is there, that is the first thing, awareness about the people, okay, and then we have to see their rights, for their rights, their dignity, right? And then yes, as he said, we have to celebrate the minor achievements what they do. So these are all concludes, like all the education and the empowerment. Yes.
So to add one more point to that is administrative organizations all over the world, internationally, nationally, state-wise also, have made it a point to give a certain quota of employment to these a person with disabilities, specifically with cerebral palsy also. So disability is now categorized into these sections, and for cerebral palsy also they have made a point. So it keeps renewing every year, every 2-3 years, and yes. So that makes a way for cerebral palsy, people with cerebral palsy. The awareness, you build up awareness, you build up opportunities, and a small child growing up knowing that there is some sort of security when if he gets education,
like a kind of a hope for them, like there is something there.
That's there.
Yes. So even I believe that over the years compared to now, so there are many facilities also made up for them, and things have been improving, and I believe it will be more improved in the future.
Yes, yes.
So like since you all are working with people with cerebral palsies, so you all must have seen them achieving many things. So what are some of the inspirational achievements of individual with cerebral palsies which you all would like to share with us?
Okay, first thing is, when it comes to our organization, we had like some children of cerebral palsy. In that, one child who is having a right hemiplegic CP. Hemiplegic means the one side of the part is affected, so there will be weakness of that particular muscles and all. So he used to come near us for the therapy and all, but he had an interest with the music, so he started learning the tabla. So for the tabla, like both the hands should be coordinated movements. So then he is the child, like he learned repetitive way, like he has been trained very nicely, and so now he plays very nice tabla.
Wow.
He goes to a college, a normal college now. So like that is a one thing. And secondly, we know one of our cerebral palsy child. So now after getting a proper training, now he's in UK doing his MBA.
Wow, that's really great.
This is like whatever we have seen, the children with cerebral palsy. So like that, we do have some of the children who are very good in singing, who are very good in dancing, but some are in the sitting they dance because some the lower limbs are affected, but some who can stand, because some diplegics, when we say diplegics, the lower limbs are affected, but with the minimal support, with the holding of the walker, with one hand with the walker, but with the other hand, so they do the dances. So these are all, like for them it will be minor, but it's a major achievement for them, it is.
Yes, absolutely. Very inspiring story.
Yes, yes.
So would you like to share?
So I think what ma'am also like what I want to say to the point is, like, we also should make our parents, educate our parents, the caregivers of the children, to celebrate every single achievement of this child. Like, we do not have to wait for the child to achieve, say, something great. Like your child is holding the head, celebrate that. Your child is sitting, celebrate that. Your child is taking their first step at 5 years old, celebrate that. Because I've seen this neglect that happens unknowingly. So what happens is, the parents do seem to they try to shell themselves, I think. When they come to know that they have a child of cerebral palsy, they shell themselves from the society, from themselves, even within the family, I've seen. So what happens is, they do not get the time to celebrate their child's achievements. And I feel these small achievements, you show the child that yes, you're doing great. I think that is where we should start for all our children, not just children with cerebral palsy, just all our children. Set the base up there, celebrate everything that they achieve.
Because in cases of cerebral palsy, it is not like you start the therapy now and you will get it in few months. No, it is like a long-term therapy where you have to, like continuously doing these therapies onwards all. So this is like not only with one therapy, this is a multi. So like whatever therapies are there, you have to do it repeatedly, then you will, yes. So here what we are looking at the independent of the children. So whichever way we can make them independent, so they can do their activity in their level, right? So this is a way like we have to think. Yeah, so then whatever, as he said, the celebrating the minor achievements, these are all, like it will give you the happiness, and you can see the happiness on the parents. If there is a smaller improvement also, but there will be huge smile on their parents' face. That looks amazing when we see it. Yes, so.
Yes. Yeah. You all have given us a lot of knowledge about this. So before we end this episode, so could you give a small message to our viewers on World Disability Day?
Okay. So as you all know, like on 3rd December we celebrate the Disability Day. So this year the theme is amplifying the leadership of a persons with disabilities for inclusive and sustainable future. So this is nothing but like here the persons with disability, they should not be lacking behind. They have to come forward and they have to lead their own way, because the families of our children with disabilities, they shouldn't be ashamed of not taking the children come out of the house. No. So they have to come out of the house, they have to explore the environment, they have to explore the world, then only they will be in a better position to handle. So at the same time, here the first will be the equality, what is major thing, because in this today's world, so then we have to give a equality is the major thing where the person should get it. Secondly, the awareness about the public. The public should have been aware about all these aspects that will give you the support from the public to the persons. Yeah, and the empowerment as well. So basically, this is like the persons with disability, they can make a decision makers, so they can take the decisions by themselves, so they are the real leaders. So that is what I wanted to say.
Thank you, ma'am. Yeah. So what would your message be to our viewers?
So to the viewers out there, I think let's try to be a little bit more inclusive of our surroundings. Let's try to learn more of what do we want to do, how much do we want to do. Let's know about cerebral palsy. Let's know what affects them, how it affects them. So cerebral palsy would not be something as drastic as the child will be only in wheelchair. Someone who's walking around you might also be suffering from cerebral palsy. So let's be aware about that. Let's try to make a moment of it. Let's try to celebrate them. Let's try to get them into our society, work as a society towards making a better society, I would say. Yeah.
Okay, thank you, Dr. Megha and Braven, for joining us and giving us such insightful information. So with this, we come to the end of today's episode. I am your host Nikita Volvekar, signing off for the day. For more updates, keep watching Purple TV Bharat.
Like, share and subscribe Purple TV Bharat.